Increased risk to injury, and this time of year it's common to see athletes prone to these injuries with fall sports back in action. Joining us today is Dr. Rowland, board-certified orthopedic surgeon and Connecticut Orthopedic Institute, to tell us more. Doctor, welcome.
Thank you. It's good to be here.
Great to have you. So what kinds of sports injuries are most common this time of the year?
Well, ironically, given what we just heard, early on in the fall sports season, mostly what we see are heat-related injuries. Those can range from muscle cramps to more serious problems such as heat stroke, or which can be a life-threatening condition. As the temperature, though, is cooling, we're going to see more traditional sports injuries like ankle sprains, overuse injuries, and ACL tears.
All right, doctor, what sports have the highest risk of ACL injury, and does an ACL injury always need surgery?
The highest risk sports for ACL injury tend to be in sports that involve a lot of quick changes of direction and jumping. So they are sports like soccer, football, basketball, lacrosse. Generally speaking, if you do want to return to those sports at a high level, most of the time you do need surgery if you tear your ACL. But if you're not going to return to those sorts of high stress activities with a lot of changes of direction and jumping, and you're more interested in doing things like distance running or riding a bicycle, or more straight line activities like that, you may not need your ACL to be operated on.
All right. Is there anything that can be done to reduce the risk of ACL injury?
Yeah, there have been several studies that have shown that certain exercise programs that focus on both training techniques of jumping and changing direction so that you hold your knee in a certain position make it less likely that you tear your ACL. And they also focus a lot on strengthening your hamstring muscle group in particular, which helps to protect the ACL. And regularly doing those activities, those exercise programs, which can be done as a warm-up as part of your sports training, can significantly decrease your risk of ACL tear.
All right. And doctor, if someone has an ACL injury at a young age, is there a risk of a future ACL injury when they return to competition?
Well, yes, there certainly is. If you tear your ACL at a young age and don't have it reconstructed, your knee will remain unstable. At that point, you're obviously not at risk for tearing your ACL again if it's already torn, but you can do additional damage to the knee if you have further instability. Also, once you tear your ACL on one side, it has been shown that you are at higher risk than average for doing it on the other side as well, which can be pretty devastating.
Interesting. All right, 20 seconds left. Talk about the importance of physical therapy when it comes to rehabbing these injuries.
Well, again, because you can try to prevent further instability episodes or injury by strengthening your hamstring muscle group, working with a physical therapist to improve your strength and to work on your techniques of how you move and how you jump, that can significantly reduce your risk of injury.
All right. Dr. Rowland, orthopedic surgeon with the Connecticut Orthopedic Institute, thanks for your time.